Now we look at the basis of testing the strength of patients. Okay, so they call it neurological testing. So for this one, we are not only trying to test out for muscle strength, you're also trying to take note of what the nerves that supply that muscle, so that that muscle is able to what still maintain its function. Okay, so neurological testing. Okay, so as you're testing for the strength, you're also what keeping in mind the nerve that supplies that very part of the body, so that part of the body is able to subserve its function. So these are the different ways to test. This for lower limb, you are trying to apply force and you are telling the patient to push against the force you are applying. Do you understand? This is lower limb, this should be upper limb. You are telling the patient to push against you. Do you understand? You are dragging the patient down, telling them to pull you up. So a lot of things. For this one, you're not only looking at the muscle aspect. I'm trying to also look at the nerves that are supplying that muscle. So that if there's any muscle weakness, I can see that okay, there's an issue in this nerve. So neurological testing for strength is actually part of the physical examination. Is what after you have heard the story of the patient, then from what you have heard, you are suspecting that maybe there's an issue of weakness, body weakness. Then now start all these things. So you try to use it to assess how well the nervous system is still controlling the muscles, and to help you to determine whether the weakness is from a nerve-related issue. I don't know if you understand, or if it is from a general muscle disease, which is not the nerve. But for neurological, you are looking out for the nerve. So key components of neurological strength testing is you have the manual muscle testings, where you're asking the patient to move against resistance. So you are pushing the resistance, you are telling the patient to move against the resistance. So you are scoring the patient. So the patient is score 0. That means the patient is not able to move at all. Score 1, they are able to move just little. Score 2, they are moving without gravity. Okay. Score 3, they can move against gravity. Score 4, this is where you now apply the resistance. So from here is level 4. Okay. Then score 5, even if you apply resistance, the patient pushes against it, that's normal strength. But that usually comes in after you have started treating the patient. So as you are treating the patient, you are following up and the patient is improving. The strength is becoming normal. Okay. So comparative between the sides. Okay. So for any limb, if you do it on the left, always do it on the right. So that if the issue is just on one side, that's unilateral. Or if it's on two sides, that's what bilateral. Okay. So both right and left limbs are tested, and weakness on one side may be suggesting that there's a unilateral issue: stroke, nerve injury, spinal cord compression. Why? You sometimes you test for specific muscle groups. Okay, the muscles that abduct the shoulder, the muscles that flex and extend the shoulder, wrist extension. We are looking at all of that. So lower limb, we are looking at for flexion, extension, ankle dorsiflexion, toe movement. So functional strength test, you're asking the patient to grip something, hold something, or asking them to push something away. This time probably is not you, maybe it's an object. So sometimes you're also stepping away to observe how they are walking, how they are moving from the chair, and all of that. So you integrate this with what reflex is testing for biceps, reflex, triceps, reflex, knee jerk. So importance, you can be able to pinpoint where the issue is coming from. And you can be able to know if the muscle weakness is from a general issue or is from a nerve related issue. Okay. Different things. Okay. You can hold their leg like this, ask the patient to bring their leg down and see how much of the strength they have.